good afternoon, everyone. My name is Nicole Kaur. I'm the Marketing Director here at Medigold Health, and I look after our webinar programme. This afternoon, I'm delighted to welcome you to the Making Men's Health Better webinar. So obviously, we're in the middle of Men's Health Week. Just a couple of bits of housekeeping. The webinar is being recorded, so you will receive a link via email to the recording as well, and feel free to share that with any colleagues that you have. That will be sent either later this afternoon or first thing tomorrow morning at the latest. There is a Q&A function just at the bottom of your screens. Please feel free to pop any questions that you have for our panelists into the Q&A. We have got a Q&A section at the end of the webinar, and our panelists will do their best to answer as many of those as possible live. If we do get a lot of questions, which we often do, and we're unable, when we run out of time, what we'll do is we'll collate those questions and we'll formulate an FAQ document that will circulate to you after the event as well. That'll be likely to be next week. The webinar does come with a bit of a trigger warning as the topic of suicide is discussed. My colleague Barry will go into that in a little bit more detail just before that topic is discussed later in the webinar. And what I will do now is just introduce you to the panel. So if we can start with you, Dr. Paul, please.
Hello, my name is Paul Richards. I'm an occupational health physician. I've worked with Medigold now for 8 months, and previous to that I was 20-something years with the British Army, and in between I worked as an expat looking after military aircrew overseas.
Fantastic. Thanks, Paul. Adele?
Hello, my name is Adele Edwards, and I've worked for 23 years in public and corporate health and wellbeing within 6 countries as a midwife, teacher, psychotherapist, and as lead health and wellbeing coach for Medigold. And I have trained in the US and the UK.
Fantastic. And last but not least, Barry.
Thank you, Nicole. Good afternoon, everyone. My name is Barry Norman Jr. I'm the mental health awareness coach and operational lead for the training and consultancy team here at Medigold Health. The team and I deliver a suite of health and wellbeing related courses ranging from disability awareness and neurodiversity training all the way through to supporting businesses to become disability confident employers up to and including level 3. I'm also a qualified mental health first aid and suicide first aid instructor. Prior to this role, I was in the military for 12.5 years, but was medically discharged for PTSD and anxiety in 2014. So I do bring a level of personal lived experience to the webinar. Over the next 45 minutes, Paul, Adele, and I will be taking you through the webinar, Making Men's Health Better. So as Nicole mentioned, please don't be afraid to ask any questions utilising the Q&A function down at the bottom. Nicole did touch on it. Before we start, I really think it's important to acknowledge that some of the topics we will be discussing today could be triggering, so we wanted to ensure that you have contact details for support if you feel the need to or want to speak to someone. So Nicole will be popping a couple of contact numbers and links into the chat for you guys if needs be. Next slide, please, Nicole. So our pathway for the next 45 minutes or so. So Paul will be talking us through the main factors contributing to men's poor health outcomes, and also looking at health issues facing men, including warning signs, symptoms, and risks. The Medigold torch will then be handed to myself, where I'll focus on men's mental health and introduce an action plan which can support everyone to become more proactive and apply that life-saving early intervention. And then we'll wrap up with Adele looking at what men can do, the benefits of health coaching and CBT, before we end with some useful information about what else employers specifically can do to help. And at the end of the webinar, there'll be an opportunity to ask all the questions you may have. But before I hand over to Paul, I want to set the scene with some facts and figures to reinforce the reason for this webinar in particular. Thank you, Nicole. So top left one. So according to Men's Health Forum and Men's Health Manifesto, men are more likely to die from heart and circulatory diseases than women. So 1 in 8 men compared to 1 in 15. And there are over 2.3 million people in the UK with coronary heart disease, where men account for 65% of these cases and a huge 75% of premature deaths from disease. In 2019, Mind published a report called Get It Off Your Chest. In that, they say the number of men who have suicidal thoughts when feeling worried or low has doubled from 10%. Okay, so that's since 2009. And men aged 45 to 49 have the highest age-specific suicide rates. There was a report done for Men's Health Forum and Cancer Research UK, which showed that men have a 37% higher risk of dying from cancer and a 67% higher chance of dying of cancers that affect men and women. For all cancers, only 39% of men are expected to live or survive their cancer for at least 10 years after diagnosis, compared to 51% of women. Linked to this is the fact that men tend to present later, which for treatment for cancers makes it more difficult. This shows us that women tend to reach out for medical help sooner, which ultimately does affect their prognosis. The final one on the bottom right, statistics about healthy behaviours from government figures shows that 25% of adults or adult males in the UK drink at levels that increase their risk of ill health, compared to only 11%. Across the UK, 15.1% of men are current smokers, compared to 11.5%, and 68% of people in drug and alcohol treatment are men versus 32% women. I'm now going to hand over to Paul, where he'll talk through men's physical health.
Hello. Well, these are factors that are contributing to poor men's health outcomes. We've got lifestyle factors. Nicole, is that the slide with the... I'm sorry.
Yeah, that's the slide, lifestyle factors. So I think Adele was going to go into that in a little bit more detail later on, sort of weights.
We've got weight, blood pressure, weight, smoking, alcohol content, and exercise. Common factors are associated with risks to health. Men are typically less aware of these factors and less aware of symptoms. They tend to accept symptoms and not question them, and they don't seek help for the symptoms. They're less likely to attend or to be aware of health screening events, and they don't proactively seek out health information. They don't tend to go to the places where health information is promulgated, particularly places like primary care surgeries. Women tend to go more often than men to these places in association with traditionally contraception, pregnancy and childbirth, and then thereafter childcare. None of this affects young men, who tend not to therefore be exposed to a lot of this information. Can I have the next slide, please? Culturally, men don't engage with or talk about their health as much as women. As I said earlier, I've spent most of my career working with a predominantly male and predominantly healthy population. They're not interested in talking about health. They're not very keen on talking about health. They're reluctant to declare any health problems. You've got all these issues of masculine stereotypes, manning up and getting on with it. But also, men are aware of the fact in these roles that these conditions can be difficult to manage, can be difficult to deal with if they do declare them. And so there's a reluctance to declare these things. Men tend to work in jobs that make it harder and more difficult to avoid unhealthy behaviors. Sedentary roles such as driving, shift work, isolated roles, particularly isolation from home and family. And this was particularly true, I noticed, in the expat community, where I was surprised at the extent of ill health problems associated with lifestyle. We have the next slide, please. So specific problems affecting men, we talk first of all about prostate and testicular cancer. Prostate cancer is seldom seen in men aged less than 50 years of age. Risk factors are a family history, particularly important. People should be aware of that and be particularly alert to any symptoms or any concerns. Ethnicity is an important factor, although it doesn't offer you any protection if you're not in the ethnic group that is more or less likely. Anyone who has the symptoms should seek advice and make sure they get checked out properly. For testicular cancer, the risk factors are family history is a strong indicator of an increased risk factor. Undescended testicles, if you have a history of that, if you were treated late for it, that's an important risk factor. And finally, ethnicity, again, white men are more likely to get testicular cancer than other men, but again, not being in that ethnic group doesn't offer you any particular protection. May I have the next slide, please? Symptoms of testicular cancer can occur at any age. Usually it's a swelling or a lump or an increase in size, which can be tender, or increase in texture, but any change is the essential thing. If you notice any change, then this can be significant. Pain is not associated with testicles. If you have testicular pain, this is an important sign. People describe a dull or a heavy pain or a dragging sensation. A lot of people describe always needs to be checked. You need to go and see your doctor. The checks is quite straightforward. They can have something as simple as an ultrasound to reassure people. The important thing is early detection, as Barry said earlier, early detection is very important. Late detection seriously affects the prognosis and is common because people have ignored these signs and symptoms. May I have the next slide, please? Prostate cancer. The symptoms of prostate enlargement, which is often not prostate cancer, affect your ability to pass urine, and people are generally familiar. Difficulty starting, difficulty stopping, having to push the urine out, dribbling or passing urine after you think you've finished. These are signs that your prostate gland may be enlarged, not necessarily cancerous. If you see blood in the urine or semen, that's a more important sign that absolutely must be checked. So the symptoms of prostate enlargement needn't necessarily mean prostate cancer, but the only way to find out is to have a check and have the cancer excluded. Most men's prostates do get larger with age, but it's very important that if you start to get symptoms, that you must have the check with your GP to make sure you don't have any signs of cancer. Once you get to signs that the cancer has spread again, this is back to late prognosis, late detection, and seriously affects the outcome with a poor outcome because of late presentation. May I have the next slide, please? Cardiovascular disease, we've already heard, is the main cause of premature death in males in this country. Risk factors for things like heart attacks and strokes include high blood pressure, diabetes, high cholesterol, and general lifestyle factors, smoking, alcohol consumption, and poor diet. Family history is, of course, very important here as well. High blood pressure, I'm going to talk a little more about. High blood pressure is very common in the population. Treatment for high blood pressure is also very common in the population. How many people do you think presented their doctors with high blood pressure? Almost nobody. High blood pressure is found as an incidental finding, usually when people are being checked for something else, or just as an opportunistic check, or unfortunately, after they've had an event such as a heart attack or a stroke. The symptoms of high blood pressure are almost none. People can be completely unaware that they have this condition. Once people start to get symptoms, possibly including headaches, blurred vision, shortness of breath, or unsteadiness, this means they're quite close to one of the serious events that we're trying to avoid. So it's important that people are aware of the fact that they can have high blood pressure with no signs or symptoms whatsoever. And the importance of this is detection. Detection enables treatment and prevention. So everybody over the age of 40 should attend for an NHS screening, which is available for every 5 years. And I would recommend an annual blood pressure check for gentlemen over 40 because it's a good way to pick it up. If you notice symptoms such as shortness of breath particularly, it's worth specifically going to get your blood pressure checked. And effective measures include stopping smoking, cutting down your alcohol, losing weight, and increasing exercise. These may be that's all that's required to treat high blood pressure, but if not, medication is available and the condition can be managed in almost every case, completely reducing the risks of unfortunate events. Finally, we talk about diabetes. This is talking about really type 2 diabetes, the non-insulin dependent type. Again, it's a condition that presents gradually over time, may have very little or very slight symptoms that people can be unaware of, commonly picked up as a chance finding when people are being investigated for other things, or just general tiredness, find that their sugar's a little bit high. Symptoms can include passing urine more often than usual, passing urine at night, feeling thirsty all the time because of the extra urine they're passing, feeling generally tired, and sometimes when the condition can get more severe, losing weight without trying to, or thrush, candida infection affecting the genitalia because of the high sugar in the urine or in the groin areas. Cuts and wounds can take longer to heal, and people may develop symptoms of blurred vision, but again, this would be when they're fairly advanced in the condition. It's associated with people aged over 40. A family history can be an important risk, but weight is the most important. You almost never see this condition in people who are not overweight. Ethnicity can have an effect as well. Some groups are more likely than others to develop the condition, but not being in any particular ethnic group doesn't really afford you any protection. If you start to get the symptoms, it's important that you should go and get the check.
Thanks, Paul. It's great. Over to Barry.
Thank you, Paul. Thank you. So really some interesting information around men's physical health. So earlier I mentioned some statistics around men's health in general. So I want to turn the focus to men's mental health. We will be talking about sensitive topics here, so I just want to reiterate that trigger warning we mentioned at the beginning of the webinar. As you can see, some of the shocking statistics surrounding men's mental health and suicide show there's a clear drive as to why this session and raising awareness overall is so vitally important. Mental health is such a huge topic, and by talking about it, we are breaking down that stigma and working to reduce that discrimination and ultimately result in lives being saved. So it's worth noting that, as with any mental health statistics, it's hard to know if the figures really represent what is happening. They can only tell us about the mental health problems that are being reported. And as we know, unfortunately, many cases do go undiagnosed. So I'm going to be talking through these next couple of statistics moving left to right. So around 75% of suicides in the UK are men. And this figure has remained practically unchanged since the early 90s. Men aged 40 to 49 have the highest suicide rates in the UK. And according to the government's National Wellbeing Survey, men reported to have lower levels of life satisfaction than women. 40% of men said that it takes thoughts of suicide or self-harm to compel them to seek professional help. And men are less likely to access psychological therapies than women, where only 36% of referrals to NHS talking therapies are actually for men. So as you can see, it's something that really needs to be spoken about, so these statistics can be changed for the better. On the surface of things, I would suggest that although men are experiencing symptoms, maybe they're not perhaps seeking help. We'll talk about this more shortly. There are multiple reasons why men, in particular, are more vulnerable to developing poor mental health. Men are more likely to go missing. They're more likely to sleep rough. They're more likely to become dependent on alcohol or report frequent drug use. They're more likely to be sectioned for treatment than women, and be a victim of a violent crime, or be in prison. All of which are risk factors for developing poor mental health. The potential triggers are essentially endless. So what are the most common triggers? Work stress, financial worries and responsibilities, especially if they feel like they're the breadwinner in their household. Maybe they have health worries, life-changing events such as retirement, redundancy. Family relationships, such as becoming a parent, relationship breakdowns, or maybe caring responsibilities for an older family member. Some love it, some hate it, but social media, individuals comparing themselves with the artificial lives of others that are on there. Maybe image and appearance. This is a huge increasing concern. A Mental Health Foundation found that 28% of men surveyed had felt anxious because of their body image. Alongside these potential stressors or risk factors, there are other reasons to why men are adversely affected. I think we've skipped a slide there, Nicole. There we are, lovely, thank you. Men may not want to appear weak as they try to live up to society's expectations. It's expectation and adherence, if you like, to traditional male gender roles, society roles, and society using phrases like man up, zip up in man suit, grow up hair, boys don't cry. I was told by my dad as a young lad, come on, boys don't cry. And this has led to my own poor mental health over the years. And this can also lead to huge unwillingness to speak up, a tendency to suppress emotions, and also reluctancy to reach out for help from friends and family, and also support services, but also in turn can drive emotions like anger. We see from our other statistics mentioned earlier on that men are more likely to choose harmful coping methods, such as drugs or alcohol, or choose escapism behavior, such as throwing themselves into work. So we've identified the problem. Let's work together to drive a change in society to make it known that it is okay not to be okay. Most methods of support have a structure. Yeah, take physical first aid, for example. Dr. ABC, danger response, airway, breathing, circulation. The structure is not only there to support the individual, but to support you in that moment. So with this in mind, I want to introduce you to a simple action plan, which is on the screen there. Okay, this can help you and help the person in that moment. Poor mental health doesn't discriminate. So this action plan can be used to support anyone. As you can see, there are 4 stages: recognize, ask, listen, and help. So let's take each step one by one to see what they mean. So recognize. Recognize is the first thing we need to do. And I think it's really important that we're aware and being able to recognize things in people and the people around us. Some common signs and symptoms could be tearful, sadness, angry outbursts, maybe poor concentration, memory issues, difficulty making decisions, maybe a loss of sense of humor, conflict with arguments or relationships. Some other signs on the screen are more focused and more common in men: smoking more, drinking more, taking drugs, substance use, anger, frustration, sleep problems, reckless behavior, or going quiet. I guess one of the main things is changes in behavior. This is something that's often overlooked. Recognizing a small change in behavior may be an early sign that someone is going through something. To recognize that something isn't quite right, the next step is to ask. I think we often avoid asking questions because we're scared of the answer, or we justify a "Are you okay, mate?" or "How's it going?" as a genuine question. We all know "How's it going?" isn't really a question, it's a greeting. We all do every single day. And if someone responded how they're actually doing, we'll probably be taken back by the response. So ask is about asking great questions. We recognize a change in behavior. Now we need to ask great questions, get over our fear of not being able to know what to do if they respond poorly. So instead of asking questions like "How's it going?" we could reword it, "How are you feeling today, Nicole?" Use a person's name. Think about questions that reassure the person that you want to speak to them and that they can be heard. Be engaged with them. Yeah, ask about the past and the future rather than just generalizing. "How have you been this week, Paul?" Yeah. "How's life treating you the last time we spoke, Adele?" Asking questions that pinpoint moments in time are far more effective than asking people generally, "How's it going?" or "How's it going, mate?" When you're asking these redefined questions and people are telling you a negative, it's really important that we listen. My other half often tells me I'm only hearing what she's saying, and some of you guys might be able to relate with that as well. I think a lot of people in society often listen to respond rather than just listening to understand, which is just hearing and not actively listening to what other people are actually saying. So when someone is actually opening up to us and telling us something that they're going through, which might be quite difficult, you literally don't have to say very much at all. It's not our role to fix or solve their problems. We shouldn't jump in fix-it mode. We should also steer away from phrases like "I understand how you feel" or "I know how you feel." These phrases don't give us a great feeling and drives up false empathy. We all have our own individual experiences, morals, beliefs, and life experiences. So it's okay to say, "I don't know how you feel, Paul, but I'm here to listen, and hopefully I can try to understand what you're going through." So we recognize the signs that someone is struggling. We've asked them some great questions or great question, and they've opened up and we've listened to them. Sometimes this is enough. Sometimes we just need to offload and give ourselves the headspace to breathe. But other times people might just need a little extra support or help. So the final step of action plan is help. We've listened, they finished. Sometimes it's then our turn to help the person find the help that they need. Helping that person find the help just means signposting to other support services. You might remain in that person's life as one of their supports, but not the support. We need to keep ourselves safe and keep them safe as well. It's like passing the ball on, so we're not responsible for that person forever, because I'm only one person and I can only do one thing. It is worth noting though, if that person is in crisis, then call the emergency services. Call an ambulance, call the police to keep the person safe. You can call the family member or friend and make a plan with that person to keep them safe. Over the next couple of slides, there's some great services, some of which I can personally recommend as well. You've got the ones on the screen, such as Samaritans, Shout. You can text Shout to 85258. Yeah. The Hub of Hope down the bottom left, or My Pickle. Really good sound resources to get support services as well. Next slide, please, Nicole. So what else can help? Yep, fresh air, change of scenery, just going for a walk around the block, take your lunch in the garden, make the most of the weather which we've got recently. Distraction, forcing your brain to think about other things that isn't focused on things we find stressful. Maybe doing a crossword or Sudoku. Mindfulness, meditation. Mindfulness is a form of meditation which involves becoming aware of what is happening in the present moment, focus on what is happening in the now, rather than focus on the past or what's going to happen in the future. Talking to someone as well. This could be a friend, colleague, family member, or a professional. Don't forget, look after yourself. You can't pour from an empty cup. Over to yourself, Adele.
Thank you, Barry. I hope everyone can see me all right with my camera. Okay, so we're going to look at what men can do. So we're looking at well-being recommendations. So mental health is having a significant impact on men's physical health, and hybrid working has reduced physical activity and can contribute to sedentary lifestyles. Men traditionally are less likely to access talking therapies. However, they have more coping strategies around doing activities. So some of these NHS guidelines and recommendations, I'm sure that you've already seen before, which is 150, you can aim for 150 minutes of physical movement over a week through a variety of activities, a maximum of 14 units of alcohol a week, and a daily calorie intake of 2,500 calories, and to limit smoking, maintain a healthy weight and reduce stress levels. In health coaching, some of the tools we use is to help facilitate activities that include improving work and life balance, activity scheduling, and task breakdown. As one of my participants recently said, a fantastic quote, "If you cannot put yourself into your own timetable, then how can you support your own well-being?" Also, some of the trends that I've noticed, home-based colleagues tend to move less. Often office-based colleagues have mentioned trying to find a regular slot to move more, and hybrid colleagues have discussed consistency with physical activity habits between sites and separating the office space and home. So that moves us on nicely to the link between mental and physical health. So mental well-being can impact physical health, causing stomach aches, sleep disorders, headaches, and lead to more serious medical issues. Health coaching supports men to increase doing activities, to reduce mental health challenges, leading to better lifestyle choices. Physical activity is a common goal area for men who engage with health coaching. Often when we experience mental health challenges, we tend to stop doing the things that we love. By moving more, it reduces your risk of major illnesses, such as coronary heart disease, stroke, type 2 diabetes, cancer, and lowering your risk of early death by up to 30%. Some of the trends I've noticed in health coaching is that participants tend to come to us after an occupational health checkup and are keen to make preventative changes. Some have pre-existing conditions or have had diagnoses from a GP, such as high blood pressure, raised cholesterol, and increases in pre-diabetes levels. Those who self-refer seem to be more ready to make lifestyle changes. Next slide, please. Thank you. So, health coaching and ECBT. Health coaching is holistic, confidential, person-centered, and encourages men to use their own strengths, knowledge, and lived experience to problem solve and reduce well-being barriers. Health and well-being coaches support people to increase their ability to self-manage, improve motivation levels, and commit to making better lifestyle choices. In health coaching, we can support you with weight management, stress management, general well-being, healthier lifestyles, improved diets, increasing physical activity, reducing alcohol intake, stopping smoking, and also coached ECBT if needed. Again, these are all doing techniques or doing activities that are helpful to men. When we work with participants that come through to health coaching, often men have a goal of physical activity and stress management. And we find that sometimes health coaching can be enough, or some individuals could benefit from ECBT to help them with additional tools to reduce stress and mental well-being concerns. Next slide, please. Thank you. So we have, okay, that's a different slide, but I'll go from that slide. Okay, so what can employers do? Employers can lead from the top. Men are more likely to engage in services when they observe others in the company having taken part, especially those in leadership. You can discuss free wellbeing services. Men can access themselves and consider implementing health coaching and ECBT in the workplace. These can be discussed at team meetings, huddles, one-to-ones, plus discussing them or highlighting these services at regular intervals. You can also remind colleagues what is available via their work, health, and benefits package. Share good news stories of men that have sought support and the positive outcomes gained. Set up a men's employee resources group with regular drop-in sessions. Create mental health champions and a network to talk about men's related health topics. Place information in important places where men are likely to actually see the information, such as toilet cubicles, and also to normalize talking about men's health. Some of the areas you can do this is including it in everyday conversation, from which will also include home workers, office workers, and hybrid workers. Webinars are something everybody can access, and also consider Teams meetings in person at regular intervals for those of us who are home workers.
Thank you.
Passing back.
Thank you, Adele. Yeah, so collectively we're seeing via management referrals, you can see there, a growing cohort of men within the 45 to 50 age group in senior management positions with chronic stress. And managers with a team of 30 plus are experiencing burnout more often than others do. So maybe introduce the bell curve that is often called the pressure performance curve to monitor those changes as well. Employers need to look at implementing preventative initiatives to avoid stress, getting to a level such as training, not just for managers, but all levels, on how to have meaningful conversations about stress, mental health, well-being. And one-to-ones, when I have one-to-ones and catch-ups with my team, it's not all about performance. Well-being and knowing what they're going on outside of work really makes a difference to the team dynamics. If you're office-based, have well-being walks. If the size of the meeting permits, go for a walking meeting, get some fresh air and top up on your vitamin D. You've got to think about what other support services are in place as well for you as an employee. Do you have an EAP, an employee assistance program? Just as organizations have physical first aiders and fire wardens, do they have mental health first aiders? Or is there a men's ambassador or wellbeing champion scheme there? Over to yourself then, Paul. Still muted, Paul?
Thank you, Barry.
No problem.
What can employers do then? Well, they need to look at preventing health initiatives, consider providing health screening within the workplace, where you can actually get to see people, where you can guarantee that they're going to have contact. Health MOTs, lifestyle screening days, blood pressure monitoring, as I've said before, very, very important. Or ensure male employees are aware of the free health checks that are available outside and that they're entitled to get on the NHS. Also make sure that they're given an opportunity to get to these things. They've got time to do that. To provide access to signposting health resources, useful websites. And I think this is key to contacting men and women in the future. Television advertising isn't any longer considered an appropriate way to reach about half the population. And these things are going to be done through apps and online, I think, in future. And we need to devise better ways to contact people and to thrust this information in front of them. Support employees who are experiencing difficulties, either physical, mental, and well-being related, again through flexibility, giving them time to rest aside from work and to attend medical appointments, and really educating managers on how to open up conversations and actively listen to their employees to draw this information out and encourage a decent exchange of views. Next slide, please.
Fantastic, thank you. It's then over to actual questions. So thank you so much to the panel. Some really interesting stuff there. I was completely engrossed. Adele's kindly put a hand up. I can see, Adele, that you want to answer. We've had somebody ask a question. You say increasing physical activity can help. However, if you are disabled, how do you recommend going about this? Over to you, Adele.
That's a really good question. I have a disability myself, and it's something that comes up very often. We tend to, if it's something that we know about, and being that obviously we are in a private confidential space with health coaching, then we do talk to the individual and we try and make sure that their journey is bespoke to looking at the abilities that they have and supporting them in those areas.
Great. Thank you for that, Adele. A question here, I think this probably is for Barry.
Yep.
So Gemma Scott, thank you, Gemma. Gemma's asked, do you have any advice for speaking with employees who are experiencing a mental health crisis but refusing to seek support, such as tips for encouraging them to be open to talking about their mental health?
Yeah, really good question. It's a correct question, does come up quite often on our training courses as well. I think it's about driving a wellbeing change first and foremost, to make it known that people can talk about how they're feeling, and just having conversations, just having regular meetings and catch-ups with the colleagues and with peers, even if there's no immediate issues or any immediate concerns at all, making it that we can just have a conversation, just have a catch up how things are getting on. And we're not just having a conversation just because X, Y, and Z is presenting with this symptoms or these symptoms. It is really difficult if people aren't willing or open to gain the support, maybe using indirect support services. So maybe having a hub or portal on your internet page to have a landing page with some direct links on there. I suppose it's very similar if you go into a tourist information centre, you've got the a rack with all the information what support services are around, maybe just having that as an indirect support rather than a direct support. Is there mental health first aiders in the business? Yeah, as Nicole's got on the screen there, utilising the support mechanisms here. I've personally used the Hub of Hope. Hub of Hope is a fantastic resource. It's the UK's leading mental health support database, created by Jake Mills, who's the CEO, and it was born out of Jake's own lived experience of extreme mental and emotional distress, and it provides basically information and support organisations for multiple avenues all under one place, and it's the first time any company and any organisations provide that information. So you've got larger organisations like the NHS in mind, but you've also got the smaller local organisations, and that's based on distance from your postcode or the GPS location of your device when you're searching. Really, really good resound support there as well.
Fantastic, thank you, Barry. So Colin Payton has asked a question, which I think will probably be pertinent for a lot of people. Some people work from home 100%. How can we and employers help to reduce isolation? Any kind of tips that any of you have got for that?
Yeah, I can chip in. So pre-COVID, we would have regular catch-ups, and obviously COVID hit. I'm the operational lead for the team. I've got 3 full-time trainers dotted around the country. We, as a team, have coffee and catch-ups every Wednesday morning. We had one this morning at 9 o'clock. Just literally just exactly what it says on the tin. Coffee and a catch-up, see how things are getting on. Sometimes the work or the conversation does slide right into work, but we do have a conscious effort to just have a catch-up, how's things going, what's happening with X so-and-so and X so-and-so and so-and-so with kids and what they got going on, hobbies and interests. But if you know about your teams and you can have those conversations and just have those regular catch-ups, just because we are working from home doesn't mean you're alone.
Brilliant. Great advice, Barry. Sorry, Paul, you're on mute.
Unmuted. I absolutely agree with that, but I would add, in my opinion, I think working from home all the time doesn't suit everybody, and that if people are suffering symptoms of isolation or perceived isolation, that maybe it needs more practical steps to bring people together, and that should be considered as maybe an indicated solution, that people are brought in, if only once a month, but to meet and discuss with other people about work and so on.
Agree. Yeah, definitely.
Agree. Thank you. Adele?
Yeah, just going back to one of the questions about accessing healthcare coaching, is there a cost? At the moment, the referrals we get are from occupational health or from self-referrals. So it really does depend on what is the process for your organisation. If it's something that your organisation does not have, then obviously we'd be more than happy to hear from you if it's something that you're interested in.
Yeah, thank you, Adele. And there will be some contact details in the follow-up email as well, if anyone wants to get in touch and get further information about our healthcare coaching services. Thank you. I think one for you, Paul, perhaps others might want, Adele and Barry might want to chip in as well, but Caroline Giles has asked, and again, I think this will be relevant to a lot of workplaces. What can they do in the actual workplace, particularly for men with remote workers like bus drivers, to encourage men to understand the risks and help us to help them reduce the risk? Practical solutions are always welcome, and Caroline has gone on to say that she's tried sharing and talking, etc., but often found very little take up. So if we've got any advice to how do we kind of tackle those kind of workers?
Traditionally, they used to bring in somebody to do a sort of blood pressure check, and people were asked to attend, and that was quite an effective way of contacting people who did work remotely like that. I think using phones, texts, apps, and so on is the way ahead. I'm not a technology person myself, but I think that that is likely to be the way in future with the younger generation. But I think my generation, they will respond better to perhaps being drawn in for something formal on occasion. It will be a way of reaching people. And if you combine that with something like, you know, something practical like a blood pressure check, which once you've paid £25 for the machine is effectively a free thing. That is one opportunity, create an opportunity to see people face to face or to expose them to things would be one solution.
Yeah, I think that's a very good point as well, Paul, in terms of maybe having slightly different strategies to suit kind of different demographics of workers, you know, with age, because different things attract different age groups, don't they? Indeed. Yeah, thank you. Adele?
I think it's an excellent point that you make. I think people tended to talk more when they were solely office-based, so they could share a lot of what was happening with them. For people that work remotely or their job is remote, then maybe asking a colleague if you can catch up with them once a month, preferably face-to-face. It can be digital as well, but keeping regular contact with people within the company. Also, it's really important that companies regularly let people know what services are available within the company that are free, that they don't have to access through their line managers, and also the service supports that Barry told us about earlier as well. It's a great question, Carolyn, and I think it's an ongoing one that people are having at the moment.
Thank you. Another good question, I think, possibly for Barry, maybe. Do you have any tips on how to approach those that seem to be obsessively working?
Obsessively working. A couple of questions back, to be fair, which are probably a little bit difficult in this Q&A session, but more so, is it just an individual that's obsessively working? If so, looking at the workload and maybe balancing it out, is there potential reasons as to why that individuals throw themselves into work? Has anything been said in the catch-ups, the one-to-ones with that individual? Is it a case of that they are obsessively working because they are away from home or they've got things going at home? I know when I went through some things several years ago, I was in work for half six in the morning and didn't leave till 7, 8 o'clock at night. And it was eventually picked up, but I didn't want to say anything because I just wanted to escape from the home and throw myself into work. So that might be one of the reasons, possibly. I think it's worth going into those conversations with an open mind, without a predetermined mindset or without a predetermined thoughts around, okay, this person could be doing this. Because if you go into that conversation with that predetermined thoughts, you might be looking for answers to satisfy those initial thoughts you've got. So going in with open mind, you just find out if it is across the board or if it is an isolated situation, i.e. this individual is obsessively working more so than everyone else. Is it a case that they are under the pressure more so? Is the work balance being shared out? It's being spread out evenly? Or is there something else that's going on? I would say there's nothing wrong with identifying and saying to the individual, say, I've noticed you've been in work quite a lot, or you point out what you've noticed and say what you've noticed as well.
Great advice. Thank you, Barry. Somebody else has asked, this is probably one for Paul. Oh, sorry, Adele. Adele, do you want to chip in on that?
Yep, thank you so much. Just also, people have mentioned in the chat about work-life balance. One of the biggest giveaways I've noticed, and I mentioned in the slides, was that one of the indicators I tend to pick up on, just people around me, and also when talking to participants, is when you stop doing the things that you love, physical activity or whatever it is. It could be, I've spoken to people who love doing jigsaws, reading, lots of different things like that. There's always a giveaway to me when the work-life balance is maybe not so good and it's starting to impact people's mental health, is when you stop doing the things you love. And it's usually often the things that we support to or facilitate people to reintroduce into their lives. So that might be also something that you can do to encourage individuals, is, you know, ask them about their hobbies, ask them what they enjoy and what they're into, and, you know, encouraging them to reconnect with pre-existing coping mechanisms.
Thank you, Adele. somebody has asked, I work in a male-dominated workplace and find physical health issues are being picked up on yearly screening but are not taken very seriously by the employees, particularly high blood pressure. Can you signpost me to more information on this? Perhaps one for Paul. You've just muted yourself, Paul.
Muted myself, yeah. The NHS has got very good guidance on this. If you Google NHS hypertension, it gives you very good and straightforward guidance. Also, the British Hypertensive Society has got very good guidance, giving values and risk factors and what you can do about it. Those would be my first go-tos. And the British Heart Foundation also has very good guidance on this. All these things are immediately available if you Google hypertension and those bodies. So I would direct them to those things. They've got authority, they've got credibility, and the advice that they give is very straightforward and clear. I find it very useful. Doctors use it for reference as much, but because of its clarity.
Fantastic. Thank you. Okay, so the NHS hypertension. Barry?
Yeah, I'm just going to add on to that, to what Paul said. So this individual saying that the health issues are being picked up at yearly screening, but not taken very seriously by the employees. If that's physical health issues, I'll be interested to see what the uptake of or the view towards mental health concerns are, mental health awareness. If that's the same mantra, if they're not being taken seriously as well. So that might be an educational piece there required in the business, in the workplace, to educate employees as well.
Yep, thank you. And Adele, you want to chip in on that?
Yes, please. A couple of the contracts we work with at the moment are occupational health based, and they are from people that have had yearly screenings, and that's usually when the health coaching service tends to start. If people are looking to be, work early to prevent some of these issues that have been raised at the yearly screening. We can also support people, as mentioned by Carolyn earlier, with disability, long-term health conditions and mental health.
Brilliant. Thank you, Adele. One here for Barry, actually, and I guess Paul as well, I think, and I guess it's a good one really about coping mechanisms in a way. So it's saying, do you find that leaving the military and working in civvy life, people don't always understand the dark humour that we had in service life to get by on a day-to-day basis? So I guess that's about sort of finding the coping mechanisms that work.
Yeah, that's why I was smiling. So when I was just reading that and I just smiled to myself. As it's being recorded, I think I'll keep my right of privacy and not comment on that one, I think. But yeah, I think being ex-military, it is a different breed, being ex-military, and they do bring a lot of different aspects to civvy roles. But it's about identifying new ways of coping mechanisms. And I still catch up with some ex-military people I know, some people I know in the military now who do the same hobby as I do, which is tabletop wargaming. Yeah, it is different, but life does move forward.
Great stuff, thank you. Again, a sort of similar theme to some of the other questions, but somebody's asked that these days so many people are going through so many things in their personal life and they want to share their thoughts, but they think that if they share personal things, their jobs could be at risk. How can we kind of solve this issue or give advice and help people to open up appropriately? So
we've got, sorry Paul, I was just going to jump in there. We've got obviously those support services on the screen there. Again, divert or redirecting to Hub of Hope predominantly, but also EAP, your Employee Assistance Program, totally confidential, 365 days a year support for you as an employee, individually led. Managers, HR doesn't have to be none the wiser. Yeah, it's all down to you as an individual. Okay.
I think it's also helpful to promote a culture of open reporting, willingness to discuss. This was done in aviation very successfully many years ago, a no blame culture, so that people could report mistakes and errors, not violations, but mistakes and errors without fear of being blamed or criticized. And it promoted open discussion. And it takes time to develop this culture, but I think the question is a very good question. And it's something that I think all management should sort of work towards to promote this openness. People are more willing these days to discuss personal matters, mental health matters than they've ever been in the past, in my experience. And I think, an open culture where they feel they can do that without fear of criticism or censure is a good thing to promote.
Yeah, thank you. Adele?
Yes, and going back to what you mentioned about culture, I think it's something, obviously with remote working as well, is to keep talking about the services that are available, not necessarily when your wellbeing and benefits window opens, but doing it at least once a month in emails, team meetings, talking about it as often as possible, so it's just almost in the back of people's minds that, oh yeah, I remember that's available, oh this is available, and I can access that without going through a line manager.
Thank you. Another one, I think, Paul, back to the blood pressure. So somebody's mentioned when they go to the doctors, the blood pressure is always raised. However, when they do a weekly sheet taking the pressure twice a day at home, it's nearly always normal. Yeah. Is there something that they can do, or is that more kind of down to the machinery?
It rather depends on the values when it's raised, but white coat hypertension, as it's called. We see this a great deal at medicals, fitness for employment and so on, where people are nervous, anxious, they come in for a medical, their blood pressure's through the roof. They say they've never had it before, they're perfectly well, they go home, have it checked somewhere else, and it's normal. You only have to see a snapshot of what it is at that very moment. And the answer is to measure it at different times throughout the day, keep a record of those measurements, and then see your doctor, show him your measurements, or her, and get your blood pressure measured again, just to make sure you don't have high blood pressure. But if you've got record of normal blood pressures at home, the chances are that that's what it is, and you don't need any treatment or any intervention. Another way of addressing this is that you can do a blood pressure monitor for 24 or 48 hours, and you wear a blood pressure cuff, and it measures it automatically over that period, if there's any concern. But a record of home blood pressure measurements is very useful, very helpful.
Brilliant. Okay, white coat hypertension. Something new that I've learned. I like that.
Every day's a school day.
Every day's a school day. Yes, thank you. Adele, you've got your hand up, or is that just from the previous?
Sorry, that was a residual one.
That's a residual one. I thought it might be. I just wanted to check. Somebody else has also said, is excessive sitting and the dangers that this brings just a men's health issue as opposed to an issue for both men and women? I would think more women than men are perhaps in sedentary job roles, whereas men are more likely to occupy manual trades where more movement is involved. I'm guessing it's across the board, really, but is that something maybe Paul can answer? Or
could you just repeat the first part of the question? I'm sorry.
Yeah, so excessive sitting and the dangers that it brings, is that just a men's health issue, or is it an issue for men and women?
For everybody. Excessive sitting is what it says. So everybody should get up, stretch, move around, have the opportunity to do that. And that should, if it's not naturally part of the job, it should be programmed in so that people can get up and stretch.
Yeah.
Excessive immobility is as bad as the sort of thing that leads to repetitive strain injury. It's conducive to good musculoskeletal health.
Okay. Thank you.
There's a lot of the like smart watches now. It does tell you if you've not moved for an hour or so, get up and move, or get up and do stretch. That's why I don't wear a watch now, because
only fast jet pilots are allowed to sit and not run for a long period.
Okay. I think we did have some great comments actually earlier on from please accept my apologies if this is pronounced Tabraze. Tabraze has sort of mentioned that actually sometimes attitudes have changed. However, there is still this kind of attitude there where women can be guilty of telling men to man up or mock them for crying, and they've actually shared that their own female GP sort of mocked them and said that you don't need counselling, you're a young man. So I think it's a really sort of good point to raise, actually. That's, I think this education is across the board, isn't it?
100%. I think I would like to say, in fact, I have seen a change in attitude over the last 6-7 years of delivering the mental health first aid course to a variety of clients and audiences. The mentality towards mentality towards mental health has improved. It's constantly improving. Yes, there are still pockets of discrimination and stigma, but by raising that awareness and by talking and by stamping it out, we are going to work to reduce it.
Yeah. I think that's a really good point. No, that's it. It's just a kind of raising that awareness.
Yep.
Because we can all be perhaps a bit guilty of inadvertently reinforcing some of those stereotypes. I think we've covered all of the questions that have come in. There's been some fantastic questions. Thank you very much for everyone who asked and engaging with those. Is there anything else from the panel that you'd like to add? Or
one thing I would like to add, if I may.
Yes, please.
I've been struck since leaving the military. One of the things that struck me is how little exercise there seems to be taking place in the younger population. People are not exercising, not participating in sports and games in the way that they perhaps used to do. Part of that is a legacy from COVID and lockdown, but also I think it's a general sort of societal trend. And if there's anything, exercise is so important in keeping control of your weight, and developing exercise habits early in life last on into later life. And it's very good for overall health. And if there's anything managers and work employers can do to encourage people to exercise, even to the extent of organizing formal events and things as part of work, I would encourage that very much, because it's something that we're losing, I think, as a society with huge health implications. So I think exercise is key to a lot of this. Yeah,
that's a really good point. Thanks, Paul. And Adele?
And I also think when we're talking about, again, something that was raised earlier, when we are talking about physical movement, doing it in a way that is using inclusive language, and also making sure that services are accessible for people. Because I know a lot of people will say, for various different reasons, but also probably because of what was mentioned earlier in the chat, I don't feel this service is for me. So things like health coaching, we are open to everybody, and everyone is very welcome.
Thank you. We've got 1 minute left, and we have got a last minute question just come in, which is a good one, actually. So what is the impact of shift work physically and mentally? Having to work early, late and night shifts can be devastating. So anyone got anything just quickly before we close? Paul?
Yes, the body clock takes 14 days to move your body clock forward by half a day, so that you're asleep in the daytime and awake at night. So people working shifts at night who are not working nights regularly are significantly low in mental and physical performance compared with the daytime, and that needs to be borne in mind as a starter for people working shifts. Their body clocks are still on their daytime body clock, which means they've got a very well recognized drop in performance while they're working at night.
Okay.
I think that's the underlying key to understanding shift work.
Okay, thank you. Well, that brings us to the end. Thank you so much to our panelists, and thank you to everyone that's tuned in. I've just put a quick slide. We have actually got another webinar next week. There will be details in the follow-up email that you'll receive, and it's we're celebrating neurodiversity next week for Neurodiversity Week. You'll see our lovely Adele again, so she's on that webinar as well, but there will be further details, and you've got the opportunity to register in the email. What I would just say as well, even if you're unable to attend the live webinar, please do register, because then you will get a link to the recording post event anyway. But yeah, just again, thank you so much to the panelists. Great session. We've had some comments come through saying what an invaluable session, and thanks to everyone for tuning in, and enjoy your afternoon.
Thank you.
Thank you very much, guys. Thank you.
Bye.